CARS Curing Kids funded a project dealing with neonatal abstinence syndrome, which is when a baby goes through withdrawal after being exposed to opioids that mom was taking during pregnancy. Normally when those babies are born, they go through withdrawal and they may receive multiple doses of opioids and stay in the hospital for potentially a long time. Prior to this study, a scoring tool that was used was called the Finnegan, and it assessed a baby on their symptoms of withdrawal. And this new approach, which is called Eat, Sleep, Console, deals with how the baby functions, how they eat, are they sleeping, are they able to be consoled. Eat, Sleep, Console was developed by a team at Yale New Haven's Children's Hospital. They implemented this approach and found significant decreased length of stay, opioid exposure, and healthcare costs. So by looking at that, and not just a checklist of symptoms, we're able to see how the baby is functioning, and by doing this, decreasing how many opioids the baby's getting. Since April, St. Mary's has had no babies that have received any opioids. Our length of stay has also gone down substantially. On average, a baby prior to this at the hospital was receiving about 40 doses of opioids. All the physicians, nurses love this. Patients who have had babies that have been treated with the old scoring system and compared to the new one have been so much more satisfied with the care that their baby has received with this new approach. Ultimately, the goal is to decrease giving unnecessary opioids to these newborn babies. Everyone loves this project. Administrators, patients, families, nurses, because it makes sense. It's the right thing to do for these babies. The CARS Curing Kids grant made this project be able to be a reality sooner than anticipated. It was able to provide educational resources for staff, for families, for these mothers to know what to expect, for prenatal counseling, and for physical resources for these babies in the hospital. I think organizations like CARS Curing Kids who fund projects like this that are so important are phenomenal. We need more of them. We need more people donating to support projects like this.